Articulations and types of movement. The classification of articulations. An articulation or joint is a point of contact between two bones, between bones and cartilage, or bone between bone and teeth. Joints can be classified as fibrous, cartilaginous, or synovial based on their structure and ability to move.
Fibrous joints. The fibrous joints are immovable joints that are held together by fibrous tissue, such as the sutures between the cranial bones found in the skull.
Cartilaginous joints. The bones are connected by a hyaline cartilage, as in costal cartilage that join the ribs to the sternum, or fibrocartilage, as in the vertebral disc. Cartilaginous joints tend to be slightly movable.
Synovial joints are free, movable joints, and two bones are separated by cavity. Ligaments hold the two bones in place and form capsules. Tendons also help establish the joint. The joint capsule is lined by the synovial membrane, which produces synovial fluids that keeps the joint lubricated. Examples of synovial joints include the elbow, shoulder, hip, and knee. Synovial joints can be divided into different types based on the type of movement that they can produce. For example, the Hegel joint can act like a hanging door, permitting movement only one direction, while pivot joint, such as the one found between the radius and luna, only allows rotation. The move ball and socket joint allows movements in all planes, including rotational movements. An example of the ball and socket joint is the hip, where the ball of the femur fits into the socket of a hip bone. Movements that occur at synovial joints are grouped in four main categories: girdling, angular movements, rotation, and special movements. Girdling is a simple movement in which relative flat bone surface move back and forth and from the side to side with respect to one another. There is no significant alteration of the angle between the bones. Girdling movements are limited in range due to the structures of an article, capsule, and associated ligaments and bones.
In angular movements, there is an increase or a decrease in the angle between articulating bones. The major angular movements are flexion, extension, lateral flexion, hyperextension, abduction, adduction, and circumduction.
We are going to talk about the special movements. Well, the special movements can occur only at certain joints, and they include actions like the elevation, that is an upward movement of a part of the body, such, for example, as closing the mouth at the joint between the mandible and temporal bone to elevate the mandible. Also, the opposite of this is the depression, which is the downward movement of a part of the body, such, for example, as opening the mouth or returning the shoulders to their original position after shrugging. Then we have the protraction, that is a movement of a part of the body anteriorly in the transverse plane. Its opposite movement is retraction. You can protract your mandible by thrusting it. Then we have the retraction, that is a movement of a protracted part of the body back to anatomical position. Then we have the inversion, that is a movement of the soles medially at the joint between the tarsals so that the soles face each other. And the opposite is the eversion, that is a movement laterally at the same joint so that the soles of the feet are facing away from each other.
Then we have dorsiflexion, refers to the bending of the foot at the ankle in the direction of the superior surface and occurs when you stand on your heels. Next, we have the plantar flexion, involves blending of the foot at the ankle in the direction of the plantar or interior surface, as when you stand on your toes. Next, the supination is a movement of the forearm that turns the palm anteriorly, whereas pronation is the movement of the forearm that turns the palm posteriorly. The opposition is a movement of the thumb in which the thumbs move across the palm to touch the tips of the fingers on the same hand. This is the movement that allows humans the ability to grasp and manipulate objects with precision.
In rotations, a bone revolves around its own longitudinal axis. One example is turning the head from side to side like when you shake your head no. Another is turning the trunk from side to side, while keeping the hips and lower limbs in the anatomical position.